I mean, people's minds get distorted from all that stuff.
Definitely, yeah, definitely.
Drugs, I mean, about marijuana and all that stuff and all the other things.
Yeah. The first handout here is, it's actually some phone numbers for all the local drug and rehab facilities. So I mean, even if you guys take us, I don't know if anybody has issues in here, there's free hotline numbers on there and all that stuff, or even if you know anybody that's suffering from drug or alcohol abuse, you could, you know, help them out and maybe give them that number. Yeah. Does anybody have any questions about any of this stuff or any of the psychiatric medications or anything? Okay. And then I have another little handout here. I kind of found this doing a little bit of research, and I think it's an excellent little questionnaire. And I wish everybody had it. Every patient that I see in the hospital, because you see a lot of patients come in the hospital and they don't know what medications they're taking and they don't know what they're taking, they don't know the doses. And I can't stress how important it is, because medications can interact with each other and they can cause negative effects, especially these psychiatric meds. They interact with some of the maybe everyday meds you take, and you need to be aware of them. So I'm going to pass this around too, so you guys can look at that. Do you want to pass it to Amber? I'll let Amber pass it off there.
How important is it to have proper nutrition and drink enough water when it comes to the mental health medication?
It's very important.
Can you explain that a little bit?
Yeah, definitely. You know, if you're not drinking enough water, or if you're not taking in enough adequate nutrition, the medication is going to affect you more. You might see some of the more of the negative consequences or negative side effects of the medication come out when you're not fully hydrated. Just you don't have enough, pretty much water in your blood, so the medicine's pretty much affecting you worse.
I just want to mention too, in terms of knowing what medications and what dosages you're taking, the pharmacies that you get your prescriptions filled at can actually give you a computerized printout. That'll give you the correct spelling, the correct names, the dosages, the instructions on, you know, how frequently you have to take them. And that's something you can keep on you. You can get it folded up, stick it in your wallet so that you have it with you in case something happens.
Which that's really important for if you go to the doctor's office. I can't tell you, just like Joe said, how many people come into the hospital and they don't have that list. And the only way for you to get the proper care that you need and for it to be identified is that we know the type of medications that you're taking. So that's an excellent point.
So if you came in a doctor's or something, you didn't know what medicine you're taking, there's no way for the healthcare workers to know. There's no way for the doctor to know. So say you're suffering from a psychiatric disorder, he might order you a medicine, but that might be interact with something you're taking at home. Did you have any more questions?
It's very important because a lot of you guys take multiple medications. You're not just taking 1 or 2. Some of you take 5 and 6. So it's really important that you have that information available. You can give in case of an emergency or something.
I mean, this is even a good cheat sheet you guys could even take to the doctors with you to look at. I mean, just to keep your thoughts together and know what you should be asking them.
And sometimes what happens is that you see more than one doctor. And so one doctor may prescribe you one medication and another doctor might prescribe you another medication that really shouldn't be taken together. So it's important to always have that list with you and keep it in your wallet or your purse.
And it's okay to ask questions. Ask questions to the pharmacist, to your doctors, to all your medical providers. It's okay to ask questions.
Yeah.
I just was going to say he brought up that question, and I've heard it mentioned several times. in groups I've attended and stuff about the water, the nutrition, and the rest. They even mention them before the proper medication, that's like the most important, or just as important as the medication you're taking, because if you don't hydrate properly or have the right nutrition and rest, it can be very hard on the liver also, as well as alcohol and other illegal drugs. Even though it's a prescription drug, the liver is basically just a filter for anything other than food and water that we put in our bodies. So even prescription drugs are actually bad for our liver. So that if we get the proper hydration and diet, the liver will be more up to standard and be able to filter that stuff out.
Exactly, yeah, when you're drinking lots of water, it's exactly like you said, it helps your body filter it through your kidneys to your liver, all that stuff. I mean, one of the questions on here is, are there any types of food or drink that you need to avoid while you're taking the medication? That says right there that, they can tell you what foods you need to be taking in or what you can't be taking in, because it's going to interact with your medicine. Some of these medicines you should take with food, which is also another question on here. I love this when I found it, because patients that come in that they don't know enough about their medicines, and medicine affects you. I mean, it might be a pill that like this big that you can barely see, but it can take a toll on you. So.
I just want to add too, the balance is important. And hydrating, drinking water and fluids and all that is important, but there's a balance. Don't overdo it, because the same medications that you're taking to help you, you can actually drink too much water and flush them out of your system. So I've had that happen too with clients where they were just drinking too much, and the medication wasn't having an effect because they were flushing it out of their system. So everything is balance, common sense and balance.
You drink too much milk, you drink too much pop.
You drink too much of anything.
Tea or anything else.
Balance, that's the key.
Oh, excuse me, guys, I have an appointment, medical appointment. I just have to excuse myself. Thank you.
Thank you.
Thank you so much.
Very nice.
What was your name, man?
Mona.
Mona?
Yes.
Fine.
How about you?
I'm Fred.
What's that?
Fred.
Fred. Okay. Nice to meet you, Fred. I see you right.
Good Easter.
Me too. Have a better one. Have a good Easter, everybody.
Yeah, you
Have a nice
too.
night.
Thank you, Mona.
Thank you.
Does anybody have any more questions on alcohol or drugs stuff?
All right, guys. Well, that's our presentation. Thank you. Thank you. Now, all we want you to do is just tell us some things you learned. What did some things you got out of? Go ahead.
Learned about that hepatitis C wasn't the thing that goes on most for missing people. That's mono. That's the only thing I did.
That's all you got out of it.
Well, I knew everything else. I just came out. I didn't have to come down here. I just came down.
You do know everything.
You were very good with those questions.
Yeah, like I knew a lot of the stuff, but that's something I did.
Well, that's good though.
Well,
That's
yeah.
good. Anything else?
Wash your hands.
Wash your hands.
Cleanliness.
Yep.
It's good about the nutrition too. Definitely nutrition. And about the alcoholism and what causes. I like how you informed us what it was and how to prevent it, the prevention measures of it, and what we should do to go on.
That was one of our main goals. We wanted to, it was basically like a primary health promotion and disease prevention. Because these are some of the little things you can do before any of it becomes serious and before it requires you to come to the hospital. It can keep you from getting that far, It's just little things that you can do. So.
I learned what colonization was. I knew what it was, I just didn't know the term.
We all got it.
I didn't know either.
And I learned about different diseases, the
Yeah.
different lice
Yeah.
You know, when you think of life, you don't think of one. You don't think of all that in one, and as a whole.
A lot of people don't realize that the crabs is the body
Exactly.
lice. That's a good one. That's a good one.
That one always makes me sick. I'm sorry.
Supposed to tear these out and give it to us?
Yeah, so there is the evaluation form at the back. If you guys want, you don't have to, but if you could fill that out, tear it off of there, and then I'll go around and get it.
Well, put my name on.
You don't have to. Any other questions, comments for us?
I just wanted to say, I think this is very good also because even Adrian mentioned that you can get, like, sometimes your pharmacy will give you things showing side effects, but it's just an example. I was put on 2 new medications a couple weeks ago, and I wasn't given anything showing side effects or anything, and I started having some, so when I went to the doctor, I asked him, and he said, yeah, that can be a side effect of that, but it was never given to me when I was, you know.
And you can always ask.
No, I could have asked for it, yeah.
Well, you ask for like pamphlets or, because a lot of times they have that and they just won't give it to you.
Yeah.
And you know, before you leave, say, do you have any education on this? Do you have any kind of materials? And they should have, you know, I know at the hospital we have a room of pamphlets and, you know, so they should be able to give you, you know.
And you can come up with your own questions.
Yeah.
You know, when
Yeah.
you're sitting at home, you have a sheet of paper, you write your own questions down, and when you do see your medical provider, take it to them.
That's their job.
That
That's their
is their
job
job.
to answer your questions.
No, they're going to act like they're busy, different things of that nature, and a lot of times they are. But get the time that you deserve with your medical provider. Ask the questions, get your answer.
One thing I always tell people is to always write stuff down the doctor's telling you. You know, even from my own experiences or people in my family, a doctor comes in, they can be kind of intimidating. They're using big medical terms that maybe you don't understand or, you know, something of that nature. And you forget half of what they told you because you're kind of stressed out because they're telling all this stuff that's wrong with you, and they're putting you on new medication, and they're talking test results, and you might not quite understand. So I tell everybody to just write everything down. It helps you keep everything organized if the doctor's telling you. And, you know, if you came in with questions, like you said, you write that stuff down, and that'll keep your mind on track, too, of stuff that you did want to know, you know. It'll keep you focused a little bit, so.
You guys did a good job.
Thanks for having us.
Does anybody want more candy?
No.